This conference is no longer being recorded. This conference will now be recorded.
Okay, now we're being recorded. I'll call the January 6, 2021 meeting of the Harwich Council on Aging to order. Before we begin, I will read the governor's order as required pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, and the governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting of the Harwich Council on Aging Board of Directors is being conducted via remote participation. No in-person attendance of members of the public will be permitted. Every effort will be made to ensure that the public can adequately access proceedings as provided for in the order. With that in mind, I'll open the meeting with a request for a motion to approve the minutes of the December 2nd, 2020 meeting.
So moved.
It's been moved by Joanne.
Second.
Seconded by Ralph. Thank you. Is there any discussion? No. Hearing none, I'll put the matter to a vote. You'll need to each all give an audio approval of every motion. So all in favor, Joanne?
Aye.
Ralph?
Aye.
Angie?
Aye.
And I am an aye, so that is unanimous vote. Thank you so much. And welcome, Justin. We see you. Oh, there you are. Hi, Justin.
Hi, Justin.
You're muted, Justin.
Yes,
The audio going. There it is. Okay. Hi, Justin.
how are you? I'm actually gonna mute because my son's doing his distance learning. He's reading out loud. So unless you guys want to hear the story, it's pretty good.
Well, we're into storytelling these days, but no, go right ahead.
He's a good storyteller. It's that Portuguese that he's got in him from his dad, you know?
I'm sure he is. I've been accused of if my hands are tied, I can't speak. So I understand. Thanks, Justin. Is there anyone on with public comment? I see channel 18, but is there anyone there here for public comment today? Hearing none, we'll move forward. First and foremost, I want to thank everybody. You know, it was such a joy last month at the Board of Selectmen doing our annual report to the board to see so many of our members on that call. I don't know if many of you watch the Selectmen's meetings on a consistent basis, but pretty much for a couple months, there are appointments every month with the Board of Selectmen with a different committee or board in town. Actually, some of those had to be postponed that the folks, the chairs, didn't show. You know, there were no reports that particular meeting. But to have the Council on Aging show up in force, you know, to be there to support what's happening at the Council on Aging was just exceptional. And I heard from a couple of members of the board to the fact that all of you showed up. So a great thanks to all of you for your continued support of the Council on Aging, for the continued support of the mission organization, and for the staff at the community center. So thank you all very much. And how's everyone doing? Joanne, you're at the doctor's. Everything okay?
Yeah, I'm fine. Excellent.
Awesome. Glad to hear it. Ralph, I know as you said earlier, you came off the pickleball court, so you're still playing. Everything good with you?
Everything's good with me. Thank you very much. Just
Awesome.
don't shut down the community center, please. I need my volleyball. I need the community center for pickleball. So,
you know, actually, kidding aside, it is important, you know, for a lot of folks in our community. Many of you know I'm in real estate, and I spoke with some folks who were looking at different communities, and they looked at one of our listings in Harwich this past weekend. And with pride, I could tell them what we have to offer in this community. And I asked the woman what her hobbies were. She said, well, that's a strange question. No one's ever really asked me that, showing real estate. I said, well, if you're coming into our community, you need to know what the community is about. And Ralph, exactly your comment, you know, how important the community center is to you is a source of pride. It should be for all of us, not only in this council, but in this community. So we're very fortunate. And thank you for making those comments. And Miss Angie, you look lovely as always. How are you doing?
Oh, thank you. You made my day. I wanted to thank Emily because she made the connection to the selectmen's meeting so easy. I wanted to thank you because I've had difficulties getting on at other times with other groups. So thank you. You made it a breeze.
Oh, thank you,
As
Angie. I'm
she
glad it
normally
worked out.
does.
Yeah.
We have someone else joining us. I don't know who it is, but welcome, whoever it is, to our meeting. At this time, I'm going to turn things over to Emily for her report. She's got a substantial report, and I'll hold my comments on a number of the different issues until Emily speaks. So, Emily, why don't you get going, starting with an overview of the current and anticipated programs and operations of the COA.
Thank you very much. I'm sad to report that we've made some changes since kind of the end of the Christmas holiday. And for the next 2 weeks, we've decided to postpone any on-site appointments and one-on-one appointments with professionals. So we've canceled the podiatry clinic that was scheduled for today. We've really pulled back the town nurse wellness clinic, though she's still meeting with people, you know, if they have an urgent need. We've canceled those thus far, and
Emily, I'm going to interrupt for just a second, if I could, because I'm having a little bit tough time hearing you. If everyone else could mute while Emily is speaking, so that everyone can hear appropriately. And I see it's Jim who's joined us. Welcome, Jim. So if everyone would take the bottom left-hand corner where it says mic, if you would click that off so we could hear Emily, I'd appreciate that. Sorry for the interruption, Emily.
not to worry. So we've canceled through the end of next week, and at this point are strongly considering canceling for the rest of the month. This is obviously in light of increasing case counts locally, nationally, everywhere, and anticipated further surges after holiday gatherings. Once a month, the first Tuesday of the month, all of the COA directors meet with Barnstable County Human Services and other regional partners. And yesterday was our meeting, and it was a pretty emphatic, do not open your councils on aging. So we're taking that seriously, mindful of the fact that we do work with folks in the highest risk category. And so we have canceled those programs again for 2 weeks and probably for the full month. We're also operating at reduced capacity again. So per the health director, Megan Eldridge, we can only have one person in the reception area. So either a volunteer or a staff member. We cannot have both. We cannot have anyone wait there for an appointment, either for the COA or for the other departments, Cemetery and Veterans Affairs. No one is allowed to wait there. So they either have to wait kind of outside of the reception area in the hallway or to remain in their cars. And again, that's anticipated for at least the next 2 weeks as well. So we're lower capacity. We've been lucky that our volunteers, our reception volunteers, Joanne amongst them, are still coming in and are serving kind of that reception role, and staff have been remaining in their offices. We may need to revisit that, but we've been able to kind of keep that one person, oftentimes a volunteer, to maintain the phones and letting people in when they have appointments. So yes, we are at reduced capacity. We did also reduce our van capacity back down to 1 passenger per trip for this 2 weeks, again, likely to be extended for the month. So that is creating some more scheduling complications. We'd really adjusted to having 2 people at a time to meet greater need. So we've imposed time restrictions on people's trips and things like that to try to make sure we can still accommodate everyone's transportation needs. So that's kind of the bad but not totally unexpected news. In terms of good news, I really wanted to highlight the holiday programs we were able to accomplish in November and December. So as we had touched on in the December board meeting, we had put out 70 Thanksgiving meals. We were able to do the same thing for the winter holiday meals on December 22nd. We had 70 meals go out. And then we had this tremendous outpouring of community support and generosity to donate gifts and gift cards and cards. We had students from Monomoy, make handmade cards. We had young folks from really all around the country who knew different COA staff members or volunteers mail in their cards here. So we were able to send out 180 gifts to local seniors, which was really, again, a total testament to the strength and support of our community here. So we did that. We also partnered with a local nonprofit called Potted Plants for Seniors, and they donated 110 plants for us to give out in conjunction with some of our other holiday programs, and they put together small gift bags as well. We've continued our annual partnership with Kiwanis to distribute 40 cranberry breads. So really, we were able to see and get things out to a lot of folks. And I do want to take this chance just to also thank Ralph. He probably gave out half of those 180 gifts. He was in and out over the course of days to make those deliveries, and it was hugely appreciated. So we did have the support of over 32 volunteers to help inventory those gifts, pack those gifts. We wrapped them all, and then to get them out to folks in the community. So it was really a tremendous showing, and I'm very grateful for the work. It was a tremendous staff effort too, so I do want to thank my staff for making that happen as well. So that was a good thing to reflect on and look forward to that support going forward.
Emily, I have a question for you. In looking at the December update, when it talks about the meal program, the lunch program, we're at capacity of 70 a day, and it says you have a short waiting list. How many people are waiting to get into that program?
You know, it varies a lot day to day. Typically, people aren't on the waiting list for long, or, you know, we can accommodate them for 2 days and then build them up to 3 or 4 days. So we probably only have fewer than 5 people on the waiting list at any given time. And then as people either step down to fewer days per week, or maybe they take a break from the program, we're able to bring new folks on. So we do kind of always have a small waiting list, but we get folks into the program pretty quickly. Joanne, do you mind if I mute you from my end? We can hear a little bit of the background noise from where you are. So if you need to, when you want to speak, Joanne, you'll just have to unmute on your phone, okay? Okay. Did that answer your question, Richard?
Yeah, it did. Thank you. I always get concerned when I see a waiting list, especially when it comes to meals, you know, how important it is for people, especially right now with the latest surge that's going on. We want to, you know, make sure however we can or wherever we can to accommodate those folks. So thank you.
Yes, thank you. I don't know if anyone had any other questions there. Again, it hasn't been much of the kind of the scope of programs that we've been providing has remained pretty consistent, except for this little 2-week and up to 4-week pause, I'll call it. We do anticipate resuming those on-site one-to-one programs as soon as the numbers change a little bit. But otherwise, things are.
Emily, question about what's the limitation on the lunches? The kitchen ability?
It is, yes. So Linda is working solo, and we do share that space with Meals on Wheels. So there is a pretty strict kitchen capacity, and then just storage space also. So, you know, how quickly we can get the food in and where we can store it.
Okay. I've had a couple of folks ask me, you know, could I get meals more often than I am now? And I didn't know how to answer that. But okay, thanks.
Sure, thank you.
But Ralph, if you find a need for that, you know, a substantial need, that I would obviously ask you to reach out to Emily directly or to Julie, you know, to see if that, as Emily said, you know, there are cases that things can be changed. Obviously, we don't want to see people going hungry at this time. That's not appropriate.
I will.
Emily, just another, thank you, Ralph. Another question. Transportation right now, I know it's difficult, and I know we're getting into a budget discussion further down. Of options for us. I know friends are having a discussion about their bus because that's basically on the sidelines, and they're spending close to $10,000 a year in insurance to insure a bus that hasn't been used in 6 months. So in essence, what we're doing now is almost a private transportation program with either 2 or 1 person on a bus, you know, and basically some private trips occurring. Is that, God willing, things are going to start changing, you know, with the vaccine coming out. But if we continue under the restrictions, we know at least the next first quarter will be restricted. But if we're going to the second and third quarter further restricted, that there are needs in the budget. If there are ways that we can look at our transportation program, because we're utilizing a big bus for 1 person or 2 people. You know, we're paying for a driver. And that's a big vehicle, you know, going out for, 1 or 2 people getting a ride. And I think the transportation is necessary. We know that as one of the core services and needs for our older adults. But reading through the reports, you know, seeing that, are there other options that we may be able to look at, you know, for our seniors that's not costing us in terms of fuel and insurance and running those buses?
Sure. I'd say at this point, we're lucky that our vehicle is so big because that's the only way we're allowed to have up to 2 people on it at a time because we do have to comply with that 6-foot distancing. So I've really never been happier to have the 12 passenger rather than only the 8 passenger so that we can maintain that distancing. It is hard, and one of the most difficult changes to our transportation program has been trying to absorb medical appointments onto the van. You know, those are harder to block off designated times for, obviously, because they vary by when the appointment is and where the appointment is held. But we're not in a position to bring back our volunteer medical driver program because, again, people can't maintain distance in their passenger vehicles. So that's been our biggest challenge, trying to make sure we can still serve those essential needs, because when folks need to get to appointments, obviously that's essential. And that's been the things that we've had to turn down from time to time. So unfortunately, absent that volunteer program, which again, we don't anticipate resuming for a good long while, we do have a shortage of other resources to connect folks to help meet that need. So yes, if folks know of other transportation resources, especially where you can maintain that distancing, we're happy to refer folks in that direction.
So if necessary, we may need to look at expanding just that use of 1 or 2 people per bus.
Right. Yes.
Okay. All right. Anybody else have any? And if not, I'll have Emily continue on with her report on programming updates.
All right. So I did include the January, February newsletter in your packet, which kind of gives the broadest overview of programs that we have going on. Again, largely unchanged, and unfortunately things have changed since this went to print in early mid-December. You can see that we have things listed as happening on site, and those are either canceled or transitioned to remote at this point. But it is in there, and everything else is accurate. We did receive the hard copies here, so I assume and hope that folks have received them at home, and the newsletter is on the website and has been distributed to folks who have signed up to receive it by email. So that's kind of it for programming updates. I'll jump into volunteer needs unless there are questions on programming.
No, just when you look at the current programs, there's the lunch distribution, pharmacy, and the grocery assistance are both great programs. And I don't know if you're hesitant to market that to the community, but I think that's something that should be out there. And you know, and I know you promote it yourself, but if we can do a better job ourselves as the COA as promoting that to people, I think that could be a great assistance to people in need right now. Yeah, I come in, I own a building here in town, so I get to come in. I've got a private office. I can come in every day. As you do, Emily, you've got an office to go into. For a lot of folks, they are sheltered, you know, and they truly are shut-ins at this point. So some of these programs may be very valuable to them. And I think it's important that, you know, we continue to publicize the programs that are available. And thank God we've got volunteers like the people on the screen today, you know, to assist with that. So just if you haven't had a chance to read the newsletter, please do. And I highlighted those things that are very important for our seniors. So and volunteer needs, I'm anxious to hear, because I've got some notes here I want to talk to you about as well. So continue on, please.
Sure. So I would say we do have, I'm pointing back to page 11 in the newsletter here, which does highlight some of the volunteer needs. Lunch drivers are listed, you know, at the top, and I'd say we're actually pretty satisfied in terms of that need. We've had a lot of new interest spurred largely by the holiday programming. We had a lot of new people come on board to get those meals out, and they're now sticking around and have taken on, you know, a recurring schedule to deliver meals. So again, if people are interested in doing that, we're certainly happy to welcome them, but it's not an urgent need at this point. Julie is really spearheading an effort to transition our pre-pandemic friendly visitor program into a remote program. So we had folks going to visit people in their homes, largely visiting homebound people for an hour or two a week, and really building those relationships. And she's working hard to transition that to a remote format so that, you know, folks can meet either by phone or using something like Zoom or GoToMeeting to continue to build those relationships. A little bit different than our social phone call program, where it would be kind of a very consistent relationship. You know, the same two folks are always meeting with each other and kind of building a deeper relationship. So we haven't had a ton of interest in that yet, but again, this newsletter did just reach folks, I believe, this week. So we hope to see some interest in that. And she's putting a lot of work into making that possible. So that's one we're excited about. And then you'll see the Shine Counselor Program. So Shine is the Serving the Health Insurance Needs of Everyone program. So they help you pick out your plan if you're new to Medicare, or during the Medicare open enrollment period, if you're looking to switch your plan or add a plan. They're really the experts in that area. We, in years past, have had 3 Shine volunteers, and we are at 0 Shine volunteers right now. The program did transition to a remote format, and that did create a lot of barriers for volunteers doing this work. So at this point, if anyone has Shine needs, we have to refer them to the regional office, the Barnstable County office, to staff members there. But we would like to have dedicated volunteers who are here to serve Harwich residents. So the Shine, the broader program does provide extensive training, and then provides training in how to offer that service through a remote format. We have a great relationship with Tracy Benson, who is the regional office coordinator. She's wonderful to work with. So I know she'd love to have more dedicated Harwich folks on board as well. So if anyone's interested, they can reach out to us to learn kind of more about how to get into that role. So I'd say those, the remote friendly visitor program and the Shine volunteers are our biggest needs right now. Again, we're in a very good position for lunch drivers, and given that we're not really able to onboard new reception volunteers in light of the reduced capacity, that's not something we're looking to add to right now either. So that's where we are for volunteer.
Emily, it's funny, if you haven't heard someone who has utilized a Shine volunteer, looking at going into the Medicare and looking at the benefits, it's a tremendous program. And I talked to some very successful business people who actually utilized the service, and it was tremendous. And it takes a special person to be a counselor there. So we'll get on to some social media posts today about looking for folks there. And the friendly visitors, it states in the newsletter that Julie's looking for 10 volunteers. Okay, so there are quite a few needs there that we need to fill. Okay, so if we can continue, folks, getting that word out to the general public in your circles and your spheres of influence, that's a great way. A good friend of mine, I lost a gentleman who was a great friend. I used to have coffee with him once a week. And his wife was alone, and there's a need, for her to have that social interaction, especially during this time. So, I've been just doing it on a volunteer basis because he was a great friend of mine. But it is truly a need. We need to get that out to the general public, that we need volunteers. So those of you who may be watching, this recording of the Council on Aging meeting today, if you have an interest of being a friendly visitor or Shine counselor, please call the Council on Aging, Julie Wheatus, and she can give you some more information on that. Anybody else want to weigh in on that? Okay. Well, let's get into the budget discussion. But let me get a precursor to the budget discussion. We are here in a support position for the Council on Aging. We don't have really any input to the day-to-day operation of the department, but we're here to support whenever we can and advocate for the budget and the department with the town. So Emily, that's a very detailed report you had provided. Thank you very much. And I'll turn the floor back over to you.
Thank you. And yes, feel free to interrupt me at any time. I know this is a lengthier discussion, and I'm happy to, receive feedback or answer questions at any time. So I did start with kind of a narrative about the proposed changes. Department heads were given a very clear directive to level fund relative to fiscal year 21. So I did submit a budget that complied with that directive. As you can see or read, one of the most difficult parts for us at the COA is to balance the services that we're providing during the pandemic with how we operate pre-pandemic and post-pandemic. So fiscal year 22 is likely to see both of those services needed. We're still likely going to be providing essential, nutrition, grocery, transportation services, and prioritizing funding for those, while also very hopefully resuming some level of on-site service and programming, or building our remote programming capacity, and those things certainly have costs associated with them as well. In prior years, prior to this current fiscal year 21, one of our largest budget items has been the subsidy to the Orleans Day program for folks with Alzheimer's and other dementia. It's really an invaluable service to Harwich residents, and we're very grateful to partner with the town of Orleans to participate in that service. But it does take a large chunk of funding. And in light of COVID, their program is shut down. They are exploring ways to bring it back soon, as early as this winter. But again, navigating the very difficult challenges of operating a program like that under pandemic precautions. So that's one of the most difficult funding pieces to anticipate. I had reduced funding by half for fiscal year 21 in light of the 6-month closure, and I've maintained that cut for fiscal year 22 in light of the uncertainty, but to have some funding available if and when they do resume. So some of the other changes, so we did maintain some changes that I had made for fiscal year 21, and then other changes for this year. As we've discussed in prior meetings, I am looking to reorganize COA staffing. So I'm looking to change the program specialist 1 position that is still vacant to a program specialist 2 position, which I feel strongly would benefit this department in terms of recruiting and retaining staff and just increasing our overall efficiency and ability to do more programming. So I did budget for that cost increase. That was one of the larger cost changes, and I did make that decision in consultation with the interim administrator and the finance director. Other changes, negotiated salary changes that are part of contracts. As we've discussed, the postage change had to be incorporated into the fiscal year 22 budget. We're no longer able to pay the nonprofit rate, so we're paying the standard postage rate, which is almost twice the nonprofit rate. So I did incorporate that. And then there were some other kind of nominal changes from year to year that are included in that narrative. We did have some cost savings that we were able to work with. Susanna Keith, the previous social services coordinator, did resign. When Julie Weedis was promoted, it's at a lower step, so there was a cost savings there. For fiscal year 21, I had sought and received supplemental funds for additional van driver coverage to be able to have 2 vans on the road at once. And we'll continue to utilize that for the rest of fiscal year 21 in the hopes that by the time we get to fiscal year 22, we can increase our ridership capacity per trip and won't need that second van on the road at a given time. So I did remove that from the request for 22. And then the other big change that we've talked about is our copier costs are very high. We do have our 5-year contract, lease contract right now. We pay for fiscal year 20, we paid about $1,300 in just overage costs on top of the contracted amount. That machine is used by other departments, but fully funded through the COA. So in light of the extensive overages we see, we're looking to transition from a lease model to a purchase model. So to purchase the machine using grant funds and then to pay the annual service cost with town appropriated funds. And so that would end up being a net reduction over what we are paying currently. And then you can see kind of the decreases that I'm maintaining from fiscal year 21 to the proposed fiscal year 22. So that's the subsidy, decrease in advertising, decrease in our computer networking cost, printing costs, and travel costs. So again, this was my best effort to balance where we are now and where I hope to be during the course of fiscal year 22 while complying with the directive to level fund. So that's kind of the narrative. And then I included the Munis report. We do submit it into the Munis software that the town uses. I don't always find that to be the most readable or user-friendly, so I also included information in spreadsheet form. So if anyone has questions, thoughts, feedback, I am interested in hearing that, of course.
My first question actually is what is the reaction of the finance director and the interim town administrator to the budget proposal?
We actually have not heard anything back from the finance director or interim administrator. We haven't had any meetings or follow-up calls, so I don't have an answer to that, unfortunately.
Okay, just and for the council to be made aware, last year, as you know, and there were some cuts made to the budget, and Emily and we advocated and lobbied to support her. We need to watch this very carefully, to make sure that we're not seeing additional cuts that are made unilaterally at the town hall level. So we need to watch very, very carefully. I think you did a great job, Emily. And to be honest with you, the Munis report, I've read them in some of my other capacities. I don't think it's necessary to include. I think the narrative was perfect, for what you have there. And I, for one, don't think you need to have that continue to be given to us. You do a great job, and I think you did a great job. And bottom line is the budget is there to meet the needs of our older adults and their caregivers in this community. And you've level funded the budget very, very well. And it's almost like you're a GM for one of these professional sports teams with a salary cap trying to work the numbers. So our team is getting younger, younger and more qualified. So you did a great job with that. Does anyone else in the council have any questions or comments relative to the budget? If not, Emily, great job. And we will continue to watch it, folks. And if there's any challenges to the budget, we will most certainly, and I think the Board of Selectmen knows that we do show up in mass when it comes times to have these discussions, and we'll be here to continue to advocate for our older adults and their caregivers in this community. Great. Old business. Anything else, Emily, that you want to get into in your report?
Nope, that is it on my end. Thank you.
It's a substantial report, and thank you for all your hard work as always. We mentioned the review of our meeting with the Board of Selectmen. Jim may not have been on, or Justin. It was a great response from the Board of Selectmen to having so many of our members on that meeting. We had an extensive report that was filed. You saw it in the copy, and people are reading it. So I appreciate all the hard work. We have some new business, and I will turn things over to my pal, Joanne. Joanne, do you have an update for us from the Elder Services Board?
Actually, there was a combined meeting for November, December, and I wasn't able to participate because of medical situation. The next meeting is January 26th on Zoom, and I will be doing that.
Great. Thank you, Joanne, for assisting us with that. And we appreciate your being available. Sorry, I'm in the office. My phone's going off. Let someone else pick it up. Thanks, Joanne. We look forward to hearing a report next month then from your meeting. Thank you. A couple other things. Justin, if you can hear me, just checking. Have you been sworn in yet? Have you been appointed? Okay.
I got a phone call from the secretary who schedules them, and I think I was in New Hampshire at the time, and I haven't gotten another phone call since, and that was probably 6 weeks ago, maybe more.
Just so you know, at the selectmen's meeting, we made it a point to remind them that we have an opening that we want you appointed to, and they were very happy to do so. If you have a chance, would you call Patty McCurra at the administration office and schedule the time with, I believe it's Don Howell, so that we can get you appointed fully and sworn in as a member of the committee. I would appreciate that.
I'll do that after the meeting.
Thanks so much, Justin. You're a valued member of this committee. We want you an official member, so thank you.
I should have taken my headphones off so everybody could have heard it in the house.
Go ahead, I'll tell them again. And I know there was a request to change the meeting time today. It's very difficult. As you know, if you see in the newsletter, we publish our meeting times, and with posting for open meeting law, it's difficult last minute to change sometimes. So I know there's going to be a time that people are conflicted with other situations going on in their lives. So we're going to pretty much keep the meeting times to the 10 o'clock. And I apologize if it does impact you. We found that this is the best time for the majority of our members. So we won't be changing unless it's absolutely necessary. Again, for people who do want to tune in or people who want to attend the meeting. It's published in our newsletter every month, and we're going to keep it pretty much there. So I have nothing further. I would be happy to go around the room. Joanne, do you have anything else for us this month?
No, I just apologize to Emily for all those trucks going by. That was with the noise.
No problem. Thanks, Joanne, and you take good care of yourself. How about Ralph?
Okay.
Anything else from you today? And thank you for all of your assistance with all of the deliveries that you do for us, Ralph.
I enjoy doing it. Thank you very much. I have nothing.
Well, we're going to keep you in good shape for both volleyball and pickleball, so keep you
Sure.
running on those trips. Thank you. Angie, how about you? Anything new this month?
Nothing new, and thank you to everyone. I appreciate all the hard work everyone has done.
Thanks, Angie. Jim, if you want to unmute, if you're listening. Jim may be challenged trying to find that mute button. So Justin, how about you? Anything from you? Okay, well, if there's nothing further, Emily, final word?
Just thank you as always. Very much appreciated.
Thanks, Emily. You guys work so hard. We appreciate it. And please pass on our best to your staff who've been working diligently during this, and especially to our pal Linda in the kitchen. I haven't seen her in a long time. I miss going in and seeing her. She's been doing a great job. And again, what she is doing is so important to this community, you know, and to your entire staff. Thank you for their hard work. At this time, then, I would be happy to entertain a motion to adjourn the meeting.
Motion to adjourn.
Thank you. We've got a motion. And Angie, you want to second that, or Ralph?
I'll second it, sure.
Seconded. Is there any discussion? Hearing none. All in favor signify by saying aye. Aye. And I need to hear an audible aye from everyone. Joanne?
Aye.
Ralph?
All right.
Angie?
Aye.
Justin?
Aye.
And Jim? And I'm an aye. So we are adjourned. Thank you all.